Chlamydia is a common sexually transmitted infection. It is one of the most frequently reported bacterial STIs worldwide. Despite its prevalence, many people are unaware of the risks and consequences associated with it. It affects millions of people every year, especially young adults. The highest rates of infection are typically found among individuals aged 15 to 24. This age group is particularly vulnerable due to a combination of biological, behavioral, and cultural factors. Chlamydia is caused by a bacteria called Chlamydia trachomatis. This microscopic organism can be transmitted through vaginal, anal, or oral sex. Once inside the body, it begins to multiply and can cause a range of health issues if not treated promptly. This bacteria infects the urinary tract and reproductive organs. In women, it can infect the cervix, uterus, and fallopian tubes, while in men, it often targets the urethra. The infection can also affect the rectum and throat. Many people with chlamydia don't have symptoms. In fact, up to 70% of women and 50% of men with the infection may not experience any noticeable signs. This asymptomatic nature makes it easy for the infection to go undetected and untreated. This makes it easy to spread without knowing it. People can unknowingly pass the infection to their partners, perpetuating a cycle of transmission. Regular screening and open communication with sexual partners are crucial in preventing the spread. If left untreated, chlamydia can lead to serious health problems. In women, it can cause pelvic inflammatory disease, PID, which can result in chronic pelvic pain and damage to the reproductive organs. In men, it can lead to epididymitis, an inflammation of the tubes that carry sperm. This includes infertility in both men and women. The damage caused by untreated chlamydia can block the fallopian tubes in women and affect sperm production in men, making it difficult or impossible to conceive. It's important to get tested for chlamydia, especially if you're sexually active. Testing is simple and can be done through a urine sample or a swab of the affected area. Early detection is key to preventing long-term health issues. Early detection and treatment are essential. Antibiotics can effectively cure chlamydia, but it's important to complete the full course of medication and inform all recent sexual partners so they can get tested and treated as well. They prevent complications and stop the spread of the infection. By taking responsibility for your sexual health, you can protect yourself and others from the potential consequences of untreated chlamydia. Remember, knowledge is power when it comes to your sexual health. Educate yourself, get tested regularly, and communicate openly with your partners. Taking these steps can help you maintain a healthy and fulfilling sexual life. Chlamydia is often called a silent infection. This is because most people with chlamydia don't experience any noticeable symptoms. In fact, up to 70% of women and 50% of men with chlamydia may not show any signs at all. This lack of symptoms can make it difficult to know if you have the infection, which is why regular testing is so important. However, when symptoms do occur, they can vary between men and women. It's important to be aware of these differences so you can seek medical advice if you notice anything unusual. Women with chlamydia may experience abnormal vaginal discharge, which may have an unusual odor or a change in color or consistency. This discharge can sometimes be mistaken for a yeast infection or bacterial vaginosis, so it's crucial to get tested if you're unsure. Other symptoms in women include a burning sensation during urination, pain during intercourse, and lower abdominal pain. These symptoms can sometimes be mild and easily overlooked, but they can also become more severe if left untreated. Men with chlamydia may experience discharge from the penis, which can be clear, cloudy, or even slightly yellow. This discharge is often one of the first noticeable signs of the infection in men. Another common symptom in men is a burning sensation during urination. This can be quite painful and is often mistaken for a urinary tract infection. Additionally, men may experience pain or swelling in one or both testicles. This can be a sign that the infection has spread to the epididymis, which is the tube that carries sperm from the testicles. It's crucial to remember that the absence of symptoms doesn't mean you're chlamydia-free. Many people can carry the infection without knowing it, which is why regular testing is so important, especially if you have multiple sexual partners or a new partner. Regular testing is vital for anyone sexually active. Early detection and treatment can prevent serious health complications and reduce the risk of spreading the infection to others. Always consult with a healthcare provider if you have any concerns or questions about your sexual health. Chlamydia is primarily spread through sexual contact. This includes vaginal, anal, and oral sex. You can get infected even if your partner doesn't ejaculate. You can also get chlamydia through contact with infected fluids. For example, coming into contact with vaginal fluids or semen from an infected person can transmit the bacteria. It's important to note that chlamydia cannot be spread through casual contact like hugging, kissing, or sharing food and drinks. Pregnant women with chlamydia can pass the infection to their babies during childbirth. This can lead to serious health problems for the newborn, including pneumonia and eye infections. The good news is that chlamydia is preventable. With the right knowledge and actions, you can protect yourself and your loved ones from this common sexually transmitted infection. The most effective way to prevent chlamydia is to abstain from sexual activity. This might not be a practical solution for everyone, but it is the only surefire way to avoid the infection. However, for those who are sexually active, there are ways to lower your risk. It's important to be informed and take proactive measures to protect your health. Practice safe sex by using condoms consistently and correctly every time you have sex. Condoms are highly effective in reducing the transmission of chlamydia and other sexually transmitted infections when used properly. Limit your number of sexual partners. Having fewer partners reduces your exposure to potential infections and helps you maintain better control over your sexual health. The fewer partners you have, the lower your risk of contracting chlamydia. It's also important to establish trust and communication with your partner about sexual health. Get tested regularly for chlamydia, especially if you have new or multiple sexual partners. Regular testing helps in early detection and treatment, preventing the spread of the infection. Talk to your partner about their sexual health and encourage them to get tested as well. Open communication can lead to mutual understanding and better health outcomes for both of you. Remember, prevention is always better than cure. By taking these steps, you can protect yourself and your partner from the complications associated with chlamydia. By taking proactive steps, you can significantly reduce your chances of contracting chlamydia. Stay informed, stay safe, and prioritize your sexual health. The good news is that chlamydia is easily treatable with antibiotics. Once diagnosed, your doctor will prescribe a course of antibiotics, usually taken orally. It's essential to take the entire course of antibiotics as prescribed, even if your symptoms disappear before completing the medication. If you're diagnosed with chlamydia, it's crucial to inform your sexual partners so they can get tested and treated as well. This helps prevent reinfection and further spread of the infection. It's important to avoid sexual activity until you and your partner have completed treatment and are cleared by a healthcare professional. Early detection is key when it comes to managing chlamydia effectively. Since chlamydia often doesn't present symptoms, regular testing is crucial, especially for those who are sexually active. Timely testing allows for prompt treatment. This prevents potential complications and reduces the risk of transmitting the infection to others. Untreated chlamydia can lead to pelvic inflammatory disease in women, which can cause infertility and chronic pelvic pain. Remember that getting tested for STIs is a responsible part of taking care of your health. It's a simple and confidential process that can save you from long-term health issues. After being treated for chlamydia, you can resume a healthy and fulfilling sex life. It's crucial to follow your doctor's recommendations and complete the full course of antibiotics. It's recommended to get retested for chlamydia about 3 months after completing treatment. This ensures the infection is completely gone. By taking these steps, you can move forward with confidence and peace of mind. Despite its prevalence, STIs like chlamydia are often surrounded by stigma and shame. This can prevent open conversations and discourage individuals from seeking testing and treatment. It's vital to break down these barriers and encourage honest communication about sexual health. Talk to your partners, friends, and family members about the importance of regular testing and safe sex practices. Remember that knowledge is power, and open dialogue can help prevent the spread of STIs. Your sexual health is an integral part of your overall well-being. Taking charge of your sexual health involves staying informed, practicing safe sex, getting tested regularly, and seeking prompt treatment when needed. Don't be afraid to ask your doctor any questions you may have about STIs, prevention, or treatment. Remember that your health is your responsibility, and early detection and treatment can make all the difference. By prioritizing our sexual health and encouraging open dialogues, we can create a future where STIs like chlamydia are no longer a threat to our well-being.